This cap is the diagnosis of reading difficulties. This last cap in the assessment series will outline what assessments should be used as one piece of a comprehensive assessment plan when trying to determine whether a student has dyslexia and what specific skills need to be targeted during special education services. These assessments are used to help determine eligibility for special education. While several assessments are named during this cap, it is not an exhaustive list of reading assessments that might be used in schools. Diagnostic assessments for phonemic awareness include the Yop-Singer test of phoneme segmentation, the Comprehensive Test of Phonological Processing, or the CTOP-2, and achievement and cognitive tests such as the Woodcock-Johnson and the Wyatt. Diagnostic assessments for beginning reading include the Woodcock Reading Mastery Test Revised and the Test of Word Reading Efficiency. Diagnostic assessments for fluency include ability tests such as Woodcock-Johnson and KTEA, among others. While completing a diagnostic assessment on fluency, it is important to note error patterns for intervention planning purposes. You need to note whether the student has high or low rates of accuracy while reading, their prosody levels, and their fluency score in relation to a grade level benchmark. As mentioned earlier, diagnostic assessments for vocabulary are less commonly used on their own, but generally include Woodcock-Johnson, KTEA, and Brigance, among others. Diagnostic assessments for reading comprehension include cognitive and achievement tests such as Woodcock-Johnson. It is key to note that since there are so many factors that contribute to comprehension, and many tests do not accurately assess all factors, teachers should always validate performance on standardized assessments with curriculum-based assessments and observations in class. When determining eligibility for special education services, 2 or 3 different comprehension tests should be used, especially when dealing with culturally and linguistically diverse learners, as many of these factors can be English learner-based. Diagnostic assessments in the factors involved in reading comprehension can include 1. Reading accuracy and fluency assessments. 2. Vocabulary assessments. 3. Assessing background knowledge on a curriculum-based topic. 4. Literal and inferential comprehension, such as the Iowa Test of Basic Skills, the Texas Primary Reading Inventory, and the Woodcock Reading Mastery Test. 5. Assessing a student's metacognitive skills. Are they able to make predictions, make inferences, provide summaries, and ask questions? And lastly, 6. Assessing a student's understanding of text structures. Are they able to understand narrative and expository text and answer questions on those texts? To wrap up, this series of caps has detailed the 3 types of assessments that can be used during reading intervention in both tiered systems of support, such as RTI and MTSS, as well as in special education settings. Screening assessments determine which students are experiencing difficulty. Progress monitoring assessments determine if students are acquiring the skills you are trying to teach them. And lastly, diagnostic assessments determine what specific problems students are having. All 3 of these assessments are integral to intensive reading intervention in a high-quality instructional environment and lead to positive student outcomes.